Hello, welcome to the JDC Diabetes Gems video of November 2013, the World Diabetes Month. Though we have been celebrating, in quotations, World Diabetes Month and World Diabetes Day for several years across the world, unfortunately, the numbers of subjects diagnosed with diabetes is increasing. The complications due to diabetes is also increasing. And in India, the numbers are pretty high at present. This month, we started experimenting with some innovative methods of spreading awareness on diabetes. Innovative methods for spreading awareness on prevention of complications of diabetes and some innovative technologies to spread the message on scientific treatment of diabetes, since all across the country or probably in many parts of the globe, patients are getting attracted to unproven therapies, ultimately succumbing to the complications of diabetes. We were quite fortunate this year to have a couple of dignitaries like the Central Minister Shashi Tharoor inaugurating the projects of Kesavadev Trust and Jothydev Diabetes Research Center. We were very fortunate to have the International Diabetes Federation President-elect Dr. Shaukat Sadikot launching our www.diabeteslearning.net, the diabetes learning portal, to disseminate scientific knowledge on diabetes to the public and patients, and having linked to various other scientific organizations like the ADA, IDF, Diabetes India, etc. etc. On November 12th, we had our launch of the programs in Kerala, starting with a diabetes walk at museum campus, and and along with the diabetes walk, we organized a free detection camp where hundreds of normal as well as subjects with diabetes approached for free blood tests. We also organized a new campaign, the Twin Bicycle Rally, which again was an innovative one, across the streets of Trivandrum city, the capital of Kerala. And subsequently, we had celebrities joining us, like the launch of the Twin Bicycle Rally, flagged off by the cine artist, come director, come producer, Sri Maniyampilla Raju. And again, it was joined by Sri Srikandan Nair, the famous television artist. And subsequently, on the 13th of November, we launched a pretty new project, the Sweet Journey, in a double-decker bus across the city. And it was on November 13th and November 14th, flagged off by the Honorable Health Minister, Sri V.S. Shivakumar. And this double-decker was so peculiar that we had diabetes screening and a live television screen and a live interactive diabetes education program, everything arranged inside the running bus. And the bus was illuminated in blue, the color of diabetes, in the late evenings. November 14th, we changed location Along with the programs in other parts of the state, we had a huge marathon in North Paravur. We collaborated with the local organizations, and we had another huge diabetes detection camp. We had a screening camp, and the program, the diabetes education program, was inaugurated by none other than the very famous leader Sri WDD Satish. And lots of people, hundreds and thousands of people were there for the program, and we also had a quiz program for the kids, which we collaborated, again organized by the local organizations, and we gave away our official diabetes t-shirts and caps to the participating children as well as the other volunteers. And subsequently, after the camp, on November 17th, we had our lighthouse in Kovalam illuminated in blue. The blue lighthouse, again signifying the importance of disseminating the message of diabetes prevention. And another innovative program, first time probably experimented in this part of the world, Dance of Diabetes, where more than 2,000 youngsters participated, and we were very successful to our surprise in between the gaps of dancing and music, interacting with the youngsters on the importance of 30 minutes of physical activity per day, avoidance of fat and sugar, excess sugar and salt in the diet, the importance of executive laboratory and physical examinations by a trained doctor at least once in 6 months above the age of 25 years, etc., 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 and taking care of the parents and grandparents with diabetes. That was another experiment. And this musical event at Kovalam Beach was inaugurated by the celebrity film director cum actor Rajasen in the presence of the upcoming Dr. Satish Kumar, the famous urologist who is now a well-known actor in the film. And there again at Kovalam, we had a free diabetes screening program where more than 1,000 subjects tested their blood for detection of diabetes. And there were a lot of people who were newly detected with diabetes. And subsequently, we had several other programs like continuing medical education programs for doctors in several locations. And on November 22nd, a major event in Trivandrum where we had a lot of other projects being launched by Dr. Jothydev and by Dr. Shaukat Sadikot. And we had the launch of the web portal. And on November 22nd, along with the program, we had 2 official International Diabetes Federation programs, and this was pinning the personality, and then the WDD hero was selected by the selected from among the audience. And in this program, we had the presence of Alexander Verghese, the UST Global Country Head, who was there pinning the personalities and recognizing the presence of Dr. Shaukat Sadikot in Trivandrum. And in addition, we had the announcement of Ganeshan Nair, a diabetic patient by himself, taking care of himself, both in the treatment, taking care of diet and lifestyles all throughout the years, was declared WDD hero by none other than the famous urologist of Trivandrum Medical College, Professor of Urology, Dr. Vasudevan Kodi. And we also had an innovative program which we initially started way back in 2006 in Kerala State, teachers training program for kids in schools and colleges, training the teachers on how to take care of diabetes in children, how to implement the basic steps in the emergency management of diabetes in kids, monitoring the blood sugars, identifying a hypoglycemia, identifying a diabetic ketoacidosis, how to make use of insulin pens, how to troubleshoot with insulin pumps, etc. etc. We have several other upcoming programs for the month of November. We also organized as part of World Diabetes Month our Jothydev Professional Education Forum CME with the Kerala Government Medical Officers Association, with Indian Medical Association at Karakoottam, etc. etc. Another major program we did at World Diabetes Month was a free detection and training and education program for the youngsters at the Technopark, at the Infosys campus. And of course, we found that the lifestyle diseases have to be taken care of in the young people in a very, very big way because of the lack of exercise and probably because of lack of time to do exercise. You will all agree that we need innovative programs and methodologies to spread awareness among the public, especially among the younger generation, where diabetes is spreading very, very fast. And I believe that our efforts, the collective efforts of all the doctors, all the organizations across India, across the globe, will of course help in the prevention of spread of diabetes. And our ultimate aim is to disseminate the scientific knowledge on treatment of diabetes, to stop patients from using unscientific medications and accepting unproven remedies. Ultimate aim should be living longer, living healthy, and preventing the huge increase in the costs of treating diabetes. And thank you very much all my friends and well-wishers for the cooperation and the blessings. See you next month. Until then, bye-bye from Jothydev's Diabetes Research Centers.